A warm welcome to you and thank you very much for joining us on the program. Now, in its 5th month since its outbreak in Congo, Chikungunya virus, a virus spread to people by the bite of an infected mosquito that causes fever and joint pain, is yet to be contained. By April, 8,000 cases had been confirmed, and now in the epicenter of the viral infection, Pointe Noire, 20 cases are treated every week. According to the World Health Organization, WHO, the scale of this virus, chikungunya outbreak, has likely been underestimated given the limited detection capacity of the surveillance system in the Republic of Congo. Ruth, I expect you to...
But we have to try. Nous allons continuer d'en parler. Quelles sont les mesures prises par
Right, so the story and the task continues. What measures are being put in place by the authorities of Pointe Noire in particular? We find out more in this story.
The chikungunya fever epidemic in the Republic of Congo is worrying, according to health authorities. The city of Pointe Noire, considered to be the epicenter of the disease, has more than 20 cases treated each week. This is a concern for local elected officials who met on Tuesday to find ways to avert the epidemic.
We have therefore asked the municipal councillors to go to the public to relay the message, and at the level of the executive office that we represent financial support measures in order to obtain some medicines to relieve the population, especially the most disadvantaged. We also urge the state to be prompt in responding both in terms of finances and logistics.
An infectious disease, chikungunya, is caused by mosquito bites due to the major fact of unhealthy living. To date, more than 100 cases have been identified according to the health authorities.
Since the 6th week to the 20th week, we have recorded 927 cases and we have no deaths. For simple cases, they are treated in all health centers. We have paracetamols and anti-inflammatory drugs. For pregnant women, they are admitted to hospital until delivery.
Since the outbreak of the disease in January 2019, the Health Administration of the city of Pointe Noire and its environs has benefited from the assistance of the Ministry of Health and some local companies that have provided medicines and communication materials.
So that's the story there. Now, our colleague journalist here in Africanews, Naya Khartoum, met the mayor of Pointe Noire, Jean-Francois Kando, and he was interested in the initiatives and progress made so far to contain this situation. And this is what the mayor had to say.
Les moustiques ont pour lieu de prédilection, pour leur reproduction, les endroits insalubres. La première leçon que nous tirons, c'est celle de sensibiliser.
Mosquitoes are mostly likely to breed in unhealthy places. The first lesson we learn is to sensitize our populations primarily on hygiene issues.
L'État que nous représentons.
And it's possible for the state to provide appropriate solutions, which begins with raising awareness.
Ces solutions idoines passent par la sensibilisation des populations. Et c'est pour cela que le public qui était en face de Madame la directrice étant un public politique.
It's a good thing that most of you here are also members of council.
Nous avons donc demandé à ces conseillers.
So we urge you, municipal council members, to reach out to our people and to relay the message. And at the executive office level, we represent financial support measures in order to obtain some medicines to relieve the population.
Financier, en vue d'obtenir quelques médicaments pour soulager les populations, surtout les plus démunies.
Especially the most deprived. So these measures must be done at our level, since these are public health issues.
Nous exhortons aussi l'État à être prompt dans
We also urge the state to be prompt in responding both materially and in terms of communication.
Naya, so Naya also asked about if there were other facts that marked the presentation of the Pointe Noire mayor there, aside from chikungunya fever.
Mais la question du chikungunya en est une, mais il y a d'autres phénomènes.
This is just one of them. We also have cases of animal bites. There are dogs and cats that give us a disease called canine rabies,
mais une autre maladie qu'on
which is also devastating in our city.
Celle-là aussi fait des ravages dans notre ville.
And on that too, we need to raise awareness among the owners of these animals.
La sensibilisation des populations propriétaires de ces animaux qui ne prennent pas les dispositions pour
the owners of these animals who do not take precautions and do not know that these animals must be treated and maintained.
Les animaux à la maison, mais nous ne savons pas que ces animaux doivent être soignés et qu'il y a le vétérinaire qu'il faut voir.
So we keep dangerous dogs at home that make them bite people on the street today, and even their owners experience the same. So there is a major campaign around this that needs to be put in place to make people aware that it is dangerous for them to keep animals, especially those that are not treated.
Qu'il faille mettre en place pour sensibiliser, pour informer les populations sur les dangers de.
It's also dangerous when these animals do not have veterinary medical certificates.
Soignés, qui n'ont pas un certificat médical, on va dire.
So that's what we can learn from this.
Voilà un peu ce que nous pouvons tirer comme leçon. Je vais résumer en termes de communication, en termes d'appui financier et en termes d'appui matériel.
I will emphasize that communication and financial budgets need to be put in place so that this can be contained.
Une interview réalisée par Naya Khartoum, journaliste ici à Africanews.
So that was Naya. He is our colleague here, a journalist, Africanews.